know when to.
So UK.
All right, very good. Well, welcome. I'm excited to see you all today, especially there's many, many visitors. So happy about that. So now we're going to do a little audience participation. I'm going to ask you actually to raise your hand. How many of you know someone who has diabetes or pre-diabetes? Please raise your hand. And it's not surprising if it's everybody in this room because 43% of US adults have diabetes or prediabetes. So I'm Kay Loughrey, Sweet Life Wellness, and I'm passionate about transforming adult health and well-being. And that's why I had a long 27-year plus career in public health, mostly focused on chronic diseases. And I've been in private practice for 13 years as a licensed dietitian nutritionist. And I learned the hard way what it takes to have a happy life at a healthy weight. That's the title of my book from decades of yo-yo dieting. I started when I got hooked on my mom's gooey chocolate chip cookies right out of the oven. And I had to become a dietitian to build a healthy relationship with food. So you can see that this is personal with me. And just to quickly go over the gains, which I was asked to include, my two business goals were I want to have two new clients a month, and one of them be a referral from a BNI member for my 12-month weight loss program. The accomplishment I'm most proud of is I was the
Just
communications lead.
just real quick, Kay.
Yeah,
I think I'm not following. Which slide should we be on?
we should be on slide 3.
Okay, can you see my slide? Can you see my slides?
Um,
What is
uh,
Sweet Life Wellness?
yeah, I will, let me just go back because I'm trying to follow a script. This was, yeah, it's still on slide 3. So slide 3 is a personal introduction. And so I'm not quite on what is Sweet Life Wellness yet. Okay.
Okay, right here.
Well, let me take this down so I can. Yeah, we're at about case still. Yeah, that should be the third slide. And Bob can help and let me know if I'm misguided here. But I'll call out the slides from now
Okay,
on.
thank you.
So
Thank you.
yeah, sorry, I meant to do that. So the accomplishments I'm most proud of is that I was the communication lead for the first ever physical activity guidelines. There are national guidelines when I worked for the federal government. And I created a coalition of 2,000 organizations at the state and local level to activate these guidelines and get people participating. My hobbies and interests, somewhat similar to what we've just heard, international travel, and I love reading. I'm also a nerd, so in the reading. Networks, I'm just about to rejoin the Greater Bethesda Chamber of Commerce, which I was previously a member of. Talent or skill, I'm an author. I love to cook when I have time. And so now we are at slide 4.
Mhm.
Frank, what is Sweet Life Wellness? And now I'm offering a personalized health, weight loss coaching, and support for adults with chronic weight and metabolism issues and ongoing fatigue, digestion, and stress challenges. I focus on sustainable change and root cause solutions. My approach is evidence-based, collaborative, and patient-centered. And slide 5, who I help, my ideal patients and clients are and is a best fit for me are clients who are adults, including business owners like Tom, who I mentioned in my 30-second pitch today, who have struggled with weight, chronic symptoms, or healthy lifestyle related health conditions, who are ready to go beyond the disappointing results with a quick fix solutions that don't work. They're midlife adults who don't make self-care a priority, and then they have problems like diabetes, like Tom I just talked about. I help them change habits and be healthy in mind and body. So why do I get better long-term results? Because I use a non-traditional approach with proven clinical outcomes. These results show that weight loss is more long-lasting when participants are mindful of their emotions and actions and choose self-directed behaviors linked to their values and chosen life direction. In other words, it's not directed by me, it's directed by my clients. That's why it's coaching. And I do coach them with some expert guidance along the way. So my typical results, I've helped hundreds of adults with their weight and health. And from our partnerships, clients make better choices and frequently have improved health outcomes. They often need less medications and they feel and look better. They have more energy, confidence, less stress, and greater mobility when they build those good habits and let go of bad habits. So you don't need to overhaul your life overnight. That's what I tell my clients. Small, consistent, healthy lifestyle upgrades tailored to your busy schedule have a big impact. So my approach is practical, science-backed, and designed for midlife adults. So slide 6, we're going to now is I'm building a network and why I'm seeking referral partners like you today who are with us at this meeting. I'm really committed to collaborating with healthcare professionals for optimal patient outcomes. And I'm targeting referral partners like primary care docs and specialists like dentists, chiropractors, acupuncturists, physician assistants, psychotherapists, and health coaches. My goal is integrated, coordinated care for chronic, complex, or lifestyle-driven needs. So coming down to slide 7, the home stretch here, how BNI members and visitors can help. So today, for referral introductions, I'm asking you to identify clients, friends, or professional contacts who are healthcare providers and asking you to facilitate warm introductions by email, by LinkedIn, or even verbal. And so, what I want you to look at right after this chapter meeting is that we have on our Sweet Life Wellness website, we have a new landing page. It's just been put up that includes a healthcare provider referral information page. And we're putting that in the chat right now, courtesy of Bob Lang. So included in that is a downloadable printable patient brochure that actually, Leslie, I'm going to be in contact with you about printing, of doing a print version of this. What I'd like you to do right now is to follow and share the Sweet Life Wellness LinkedIn company page, which we've just put up. I only have 2 followers, so please go there now and follow me and check out what we have. So slide 8 is just a thank you and our next steps. And together, let's empower more people to enjoy a fulfilling, happy life at a healthy weight. And my contact information is there for you. So I can be available in one of our breakout rooms after the meeting if you have medical practices as clients or no health professionals who might be good referral partners, or we can just set up a one-to-one. So I want to thank you all, and Frank, all done. Back to you.
All right. Thanks so much, Kay. I appreciate it. Let me
Thank
just
you.
switch back over, y'all. 1 minute. Let's see. Y'all see my screen all right?
Yes.
Great. Let's jump back into this. All right.